Thanks everyone for joining us for the first webinar of our Spotlight series on research policy partnerships. My name's Sarah Ely, I'm from Health Translation SA, and I'll be your host for this series, which is going to run over the course of the next 4 weeks. I'll start by acknowledging the Kaurna people, who are the traditional custodians of the Adelaide region, which my feet are on. I recognise their cultural, spiritual, physical and emotional connection to the land, and I honour and pay my respects to the Kaurna elders past, present and into the future. And I imagine a lot of people on this webinar today are in Kaurna lands, but feel free to pop into the chat where you're zooming in from if it's somewhere else. So the Spotlight series, for those who are new, is an initiative that was launched by Health Translation SA in November 2021. It's a way of building knowledge and capacity in a range of essential research, translation skills and topics which may not be well understood. And so we do this through a month-long focused education initiative, which includes 4 weekly online webinars where we hear from a range of experts, and we dedicate our socials to sharing information relevant to the topic as well. So it's exciting that this is our 7th series, with previous series have covered implementation science, research impact, community engagement, the MIRFF, health economics and patient-reported measures. And for any of those previous webinar series, you can access the recordings on our website. Just briefly, who are Health Translation SA? We're an NHMRC accredited academic health research translation centre, and we offer a collaborative cross-sectorial approach to research and enabling translations of findings into improved patient care. So essentially, we seek to connect the health researchers and the health services with the right stakeholders and partners to accelerate the implementation of research discoveries. And our partners are at the bottom of this slide, and you can see there we have 11 academic research and healthcare agencies which encompass the breadth of health service delivery in South Australia. And our vision is to accelerate the translation of research findings to improve the health of South Australians. We work with our partners and other stakeholders as an independent catalyst and broker to mobilise collaborations, and these are ones that address major health system challenges. We do this through a variety of ways, which you can see in this diagram, and the Spotlight series that falls under education and training. So to today's webinar, which is why you've all tuned in, we've got 3 excellent and experienced presenters today. We've got Professor Jacqueline Bowden from Flinders Uni, Marina Bowshall from Wellbeing SA, and Cenko from the Drug and Alcohol Services South Australia, which is within the Department of Health and Wellbeing. First up, we're going to have Jackie. She's going to present and discuss how, as a researcher, she's utilised her research findings to inform government policy, and she's going to provide examples. After that, Jackie's going to run a panel session asking questions of Marina and Clinton. They've both worked with Jackie on tobacco control policy for many years. So before I hand to Jackie, I just want to quickly introduce the speakers so we all know who we're talking to. Jackie, she's the Director of the National Centre for Education and Training on Addiction at Flinders Uni. She is a behavioural scientist who's worked at the interface of research and public health policy for more than 20 years, and this is particularly in the tobacco and alcohol control, but more recently other drugs as well. Marina, she's in a brand new role. She's recently commenced in the role of Interim Chief Executive at Wellbeing SA. But previous to this, she led the Drug and Alcohol Services SA, which is a statewide health service operating through Southern Adelaide Local Health Network and the Department of Health and Wellbeing. As an experienced policy and health services professional, she has built a reputation for delivering and influencing public health outcomes through effective integrated responses. And lastly, we have Clinton, and he's the manager of the Tobacco Control Unit for DASA, the same organisation, working in SA Health and public health issues for over 20 years. He's overseen the implementation and package of tobacco and e-cigarette legislation, and this has included smoke-free pubs and an online sales ban of e-cigarette products, among many other things. He's currently working on the new national vaping reforms, including bans on the importation of e-cigarettes and a ban on disposable vapes. So I'm going to hand over to Jackie, but just to let everyone know, if you've got any questions of anyone during this session, please pop it in the Q&A and we'll get to as many of the questions as we can. But Jackie, I'll hand it over to you and I'll stop sharing.
Thank you very much, Sarah. Okay, let me share my screen now. Just take me a minute. Okay, slideshow. There we go. Can you see that, Sarah? Perfect.
Definitely. Thank you.
Okay, thank you very much, everyone, for joining us today. I hope you're sitting back with your lunch and keen to listen to our policymakers in particular. So I'd firstly like to acknowledge that we're on Kaurna land. I'm coming to you from Flinders University, and I'd like to pay my respects to elders past, present and emerging. So as Sarah mentioned, I'll be giving a presentation, then I'll be asking some questions of Clinton, then Marina, and then we'd open it up for a Q&A from the audience. So along the way as we're talking, please feel free to put questions into the Q&A function or afterwards, after we've had our set questions. So because this is the first part of the Spotlight series, I just wanted to give a bit of background about what is public policy. And it is the most, the shortest definition that's available, but actually is probably the most true, is anything a government chooses to do or not to do. And that highlights three key things: that really the primary agent of public policy making is government, and they have this unique ability to make authoritative decisions on behalf of citizens, and they can back this up with the potential for sanctions. Policy is a choice made by government to undertake a course of action or not do something is also in some ways a policy decision. It is a conscious choice, and so when government do bring about policy, they are also aware of the unintended consequences or the potential for such unintended consequences, and need to be mindful of that when developing policy. But it's less clear about how decisions are arrived at or implemented. So really, though, government actions are a result of interactions between evidence, so research findings and a body of evidence and data, and I'll talk a lot about that today, but also their interactions between institutions, Parliament, Cabinet, courts, public service, and really importantly, power as well. So it's about who has access to and influence of decision makers, the political capital of decision makers and whether they're willing to use it to progress a certain policy. It's about interest groups who are both supportive of and sometimes against policy. It's also about media and stories that are being told by the media, because they often shape public opinion. And really importantly, it is also about public opinion and community support for various policies. So in my experience, with ministers, they're not too interested in doing things that aren't going to be supported by the community. So in terms of policy, the Kingdon's three streams model highlights that if you're wanting to make effective policy change, the problem must be really well defined. And this can happen slowly and be developed, which is often the case in health and health policy. But it also can happen really quickly. For example, COVID, where things needed to be decided on really quickly. In terms of the policy itself, that can be developed in academia, in think tanks, and often by policymakers. So it's important for researchers to get in touch with policymakers early on to find out what policies might be palatable and workable and realistic, and find out which ones just aren't realistic, are too expensive, and violate some of the legislative processes that government need to abide by. Also, politics, I think, is really underestimated. But really important. It's really a combination of the national mood, community support, the media around a certain topic, the opinions of elected officials in decision making, and how vocal interest groups are on all sides. When you have things working really well, you have a defined problem that exists, an acceptable solution and political will to do something, then you have what's called a policy window. And sometimes that can be really short-lived, and sometimes it can be long enough for implementation. So today I'm going to talk about a case study in tobacco control and a couple of areas where we've been able to influence policy from an evidence perspective. So the problem, it's an unparalleled toll on health. A unique consumer product, when used exactly as intended, it kills 1 in 2 long-term users, and each year we have 21,000 Australians dying prematurely from smoking. So that is an important problem that policymakers really understand, and we've had multiple policy solutions to address this problem. So as you can see with this graph here, there's been a very multifaceted strategy in place. It's important to consider the environments that people that smoke are within, and also be able to provide prompts to get people who smoke to consider quitting. And so you cannot attribute the success in tobacco control to any one initiative. It's a comprehensive approach that's happened over many years that you can see here. We do, however, still have higher smoking rates among certain population groups, people living in disadvantaged areas, people living with mental illness, and Aboriginal and Torres Strait Islander peoples. So we need to do a lot more. It's not done, and we still need to look at getting population smoking rates down. But I'm going to talk today about some examples in social marketing. Obviously, these are about individuals and health, but it's important to remember this is part of a wider, broader context of policy regulation as well. But in terms of mass media campaigns, we know in tobacco control that really well-designed mass media campaigns are proven to increase quitting and reduce smoking rates in adults and young people. They encourage smokers to personalise the health risks of smoking, to keep quitting on the agenda, and increase understanding of the quitting process, and provide treatments and options and services. So they prompt quitting, they reduce the social acceptability of smoking, and importantly, something that people don't think about much, but they also serve to build public support for the implementation of other policies. So policy is hard when you don't have community support. These campaigns serve to remind the community of the harms of products, which then allow people to understand why policies need to take effect. But it's also really important to be careful not to blame the individual. And in tobacco control, we've been very conscious about that. We fully understand that smoking is an addiction promoted by industry. So here's an example of an ad. I'll see if I can play it. This was developed by Drug and Alcohol Services, and this shows you the sort of social marketing campaigns that I'm talking about. So I'm going to talk about the importance of data to overcome politics and continuing research after a policy is implemented. So the challenge is that we know TV advertising is really effective. We've got a lot of evidence to support that, but it is also an expensive strategy. And to have optimal level of population reach, in South Australia, you need to have a budget of around 1.5 million per annum, and it may be a little bit more than that now. Some time ago in July 2013, there were some state government budget cuts. So we had a Minister for Health that had come directly from being Treasurer prior, and they were trying to make budget cuts in health, and decided that naturally they're looking to make cuts where it's expensive, and they decided to cut the social marketing budget for tobacco control. So what happened next? Well, I was involved and included in a team at SAMRI, and our job was to evaluate the effectiveness of government campaigns, and also broader government strategy for the state to work out what's the most effective return on investment. So we collected population data annually on smoking rates. We could see that between 2010 to 2012, where there was high intensity advertising, we had significant declines in smoking rates. But after the terminating of the mass media campaigns, unfortunately, we saw an increase in smoking rates again. And we saw a decrease in awareness of anti-tobacco advertising. We also looked at quitline calls, and we found there was a big reduction in calls to the quitline. So a reduction in calls to people seeking help when to quit. So they just weren't going through the quitting process. So what did we do with this? Well, we presented this data to policymakers. Policymakers presented it to the minister. We also knew that NGOs like Cancer Council and Heart Foundation were aware of what was happening because they had data themselves as well, and they were pushing the minister to reinstate the campaigns. And what we saw was a reversal of the decision very shortly after we've got that data. So the minister reinstated campaigns, and then we were able to see a continuing reduction in smoking rates in the following years after that. So I think we can attribute this to having a clearly articulated problem. We know smoking causes many harms. We had quality and timely evidence. So we didn't just have a survey of 20 people. We had large population data sets. We provided briefings internally rather than waiting for time to publish. There was a policy or a solution. In terms of politics, we had mature relationships between us and policymakers. And NGOs were also involved in meeting with the minister, and they did so predominantly behind closed doors. But I think the minister was aware that if things weren't going to change, that those NGOs may go public too and pressure the minister publicly. And importantly, we had a minister who listened and reversed the decision. So that was a really good outcome. We did also eventually publish, and now this research is being used by others across the country to remind governments of the importance of campaigns. The other example I'm going to talk through is a point of sale display ban that came into effect. So the problem was that product displays, especially near cash registers, increase unplanned purchases of consumer goods. So there's very clear evidence around this. Back in this time, we had these power walls that were serving as advertisements for tobacco products. And they were doing this because advertising was no longer permitted. So the policy option was to ban point of sale displays. In terms of dealing with the politics and looking at the data, we found that we did some research in South Australia and found that actually 63% of the community would approve of a ban of cigarette displays, and many thought that this should happen in the next 12 months. We also found that only 7% of adult smokers actually chose the brand of the cigarettes that they were going to buy at the point of purchase, and 90% made their decision beforehand. But what these power walls were serving to do was undermine the resolve of people who were trying to quit, stay quit. You know, if they're going to the supermarket, they're walking past these displays that are looking fantastic, it gets them thinking about smoking again and, you know, really easily able to purchase them. So we presented all this data in a policy briefing, and we also provided a question and answer fact sheet for policymakers, because we know that industry are often, they've got arguments, they're using them in the media, these things won't work, and all the rest of it. So we thought about all of the arguments that industry might put forward to try and undermine legislation like this, and we put forward evidence-based responses. And on top of that, there was a coalition of NGOs pushing for a ban as well. So they were meeting with the minister, they were meeting with other MPs and pushing for a ban. And in 2012, we were successful in getting a ban. So the key takeaway, I think, from a couple of these examples are that translation from evidence to policy can take time and many players, and sometimes you'll be, conducting research and feeling like it's not being listened to, and then all of a sudden something might happen, and then the policy window opens. You have a minister who's interested in the cause that you have been collecting data on and wanting to hear about it. It's important to talk to policymakers from the start and find out whether they see the problem in the same way that you do, what data or research they might need to make decisions, and building a program of research around that to inform their practice and potential policy options. Thinking about what could be the unintended effects, and is there research needed there to work out, are there tweaks needed in policies to reduce the potential unintended effects? Are they workable, the policy options that you're considering, or is there a better approach that policymakers can suggest? Do they think that the minister of the day is supportive of your cause? Is there community support for particular policies? And if not, it's important to consider promoting the findings of research in unpaid media over a longer period of time to build awareness about the problem that it is that you are considering helping to change. In terms of timing, I think publications can increase credibility, and we'll ask Marina about what she needs in terms of making decisions. But the trade-off of that is time as well. So policy briefings can be really important. Q&A sheets can also be helpful to refute industry claims. Building the narrative that the problem is big but the fix is easy, and this is how you do it, can also really be helpful. Keep telling your story and the importance of it, and maintaining the passion, and don't be dismayed by the fact that right now it might not happen. It could happen at any time, so be ready for that. And as I've suggested in one of the examples here, keeping on collecting data after policy is implemented is really important for unintended consequences. And also, if you're looking at changing policy in an area where industry are very active, they can often come into play afterwards and try and undermine that policy in some way, shape or form. So collecting data is really important to be able to potentially refute any industry claims if there are any. So that's it from me. There's my details if anyone has any questions. I do have another example about how we're involved in banning salaria, but I think I'll keep that for now there, because I think it's important to hear from our policymakers in particular. So I'll stop sharing my screen, but if anyone has any questions about how we're involved in salaria and the decision around that, I welcome them. But now I might hand over to Clinton. I've got some set questions for him. And so I'll ask those questions of Clinton now. And as I said, feel free to put any questions in the Q&A chat function as well. So Clinton, I've talked a bit about policy, but I think it would be really worthwhile for the audience to hear operationally, like, how does research feed into policy documents and legislation? Can you kind of step us through the process?
Sure. Thanks, Jackie.
Thanks.
I'll just answer that by sort of premising my answer to say, when I talk about policy, I'm sort of broadly talking about new initiatives, new laws, or sometimes new programs. Also, that policy, as you've indicated, is it's sometimes not a clear beginning and end to that process, so that can become a bit tricky to explain where it started and where it ended. And also, that my view is that research plays a big part in policy formation in multiple at multiple points and in multiple ways that are not obvious sometimes. So to your question, which is the procedure of a new initiative, a new idea comes about, and that might have arisen from a strategy document, for instance. We have the South Australian Tobacco Control Strategy, which has just been newly released. However, it could come from purely from a scenario where a minister or someone else of authority comes and says, can I have 5 things that you'd say that we should be doing in this area based on what you know of the evidence and what we think we can do. And that's just a reality as well. That's not just a South Australian thing. That's an observation of the reality of public policy internationally. Now that flows ultimately to assessing that idea, that measure, with potentially a consultation process, like a public consultation process, a stakeholder consultation process, and based on that, we get a feel for the public appetite for that particular initiative, but also sort of smooth out the edges if there's any implementation issues or pushback or disquiet that might emerge from a particular element of that particular idea. And then ultimately it goes to Cabinet, which is a small group of government ministers who would make key policy decisions. And it goes to them as a report with a recommendation to introduce that policy. And it lays out the case for that particular policy by citing and referencing and summarising evidence. That goes to Cabinet, and a decision is ultimately made, sometimes with a bit of back and forth, to either introduce it if they can straight away, or it could go to Parliament, let's say as a bill, as an amendment to an act in Parliament, and it goes to Parliament for debate, and hopefully a new law, or in this case, a new law emerges. So that's really the procedural process around a policy process. However, I also just want to broaden that to the reality of what goes on with public policy, and that is, and I use an analogy of a tree, whereby that process is probably more like a stem or a trunk, but underneath that there is a root system and a soil system that feeds into even sort of getting any kind of growth of an issue or a policy or an initiative at all. And those roots might be a parliamentary inquiry, an election commitment, an NGO position paper, an incident in the media. It could be the minister's personal passion for an area or their personal experience with an issue. It could be something that happened interstate, where we're looking at it now because we're interested in that example of what they've done, or a new national initiative. It also has the roots of pushback by businesses. What are they saying, particularly in the media, and how much power and influence do they have as opposed to advocates, in particular in our case, health advocates. And then there's the influence of public servants and the commitment to a target potentially in a strategy. Now, all those different elements are sitting on a foundation of research and evidence. So the expertise, the position papers, the media stories, hopefully, the views of advocates have research feeding into it. So I guess I'm just trying to emphasise the point that, you know, there's this system of factors that flow in, and they're not completely isolated from research, even though it seems sometimes like they are. I think that this is all informed, hopefully, by research. But ultimately, the soil system as well is this kind of body of societal views about an issue. You know, how is the problem seen in society? For whom is it a problem? What are the prevailing ideologies and discourses? And the whole concept of problem definition. So that feeds in as well, and that can be more nebulous and sometimes difficult to define. And sometimes we need to be studying that area of why we think an issue is a problem, etc. So that's a long answer because it's a complicated and intriguing kind of dynamic.
Yeah, it is. And the tree analogy is fantastic too. Good to think about it like that. So Clinton, what sort of research is most valuable to public health policy to inform decision making?
Well, I mean, all along that process, there is potential for different forms of research, and in particular tobacco control. We're really blessed because we have a network of researchers and research which provides just a fruitful body of information that we can draw on in order to build the case for a variety of different initiatives for progression. However, the one I just want to hone in on, which I think is an area of opportunity, is the need for policy analysis, which you sort of touched on a bit, Jackie, and that is the need for the design and testing of new ideas and initiatives in a way that has real-world application. And sometimes that might involve thinking outside the health sphere and thinking about business and economic impacts, social impacts. Maybe it involves modelling. It involves certainly assessing assumptions and arguments for and against an issue, so that we kind of basically a bit. You referred to John Kingdon, and that who's a theorist who published widely in the mid 80s, and he could have talked about a policy entrepreneur. And a policy entrepreneur is a person, it might not be just government, could be non-government, but they sort of have these ideas for new things ready to go, almost in their top shelf, so that when someone asks, they've got them ready. But you've got to kind of be ready. And I say as a field, we've got to kind of try and grapple with how do we get more ready with our top 5 things, with our initiatives that have been tested and the assumptions are tested and the impacts tested in various different ways, so that we're much closer to rolling them out rather than trying to cobble them together in a rushed and potentially less than comprehensive way. So yeah, it's that policy analysis for the purposes of having stuff ready, which I think is a real area of opportunity.
Yeah, thank you. So having stuff, so you need things ready to go just in case you're asked, and then if researchers can be considering testing some of the assumptions and how will it be applicable in a real world context if that policy was to come into place, so modelling and that sort of thing. I think you've probably answered my next question, but I might ask it anyway. Is there any sort of new or more research that might be needed for you, do you think? And is there any particular research you weigh up as better than others?
In terms of policy analysis and those opportunities, if I was to give examples of areas that might have some merit in analysing and within the Australian context, it might be the New Zealand smoke-free generation concept. And I think there are researchers looking at this, but they're introducing a new law relating to age, a moving kind of age restriction on access to tobacco, whereby effectively over time it will become increasingly banned in terms of purchase or sale. I mean, it's sort of the assessment on the analysis of that model in Australia, I think, and how may or may not be different is really important. So if we get asked the question of whether we should be doing it here, what's our answer? In the alcohol space, if we digress a bit, minimum floor pricing, what are the business and economic impacts and social impacts of a minimum amount you have to pay for alcohol? Things like the PBS at the moment subsidises nicotine replacement therapy, patches, etc. Now that's arguably the biggest program we run Australian-wide in terms of tobacco control. I think it's about $50 million a year. I don't know. I'm not aware of any analysis of how well that's going in terms of the effectiveness of that approach from a policy perspective, and yet it's been in place for over 10 years. So, there's a real opportunity to analyse whether we're getting that right and whether there's opportunities to do that differently or make the case for doing that differently. And of course, as you said, tobacco campaigns, we're in a new generation of media where it's all different than it was 10 years ago. So we have to be adapting to that scenario and saying, well, what are the opportunities there? How do we actually change to a screen viewing dynamic that is very much different to the kind of like very linear television viewing that we're used to maybe 10 or 15 years ago? So that's the sort of examples of things where they sit there. They seem complicated, and that's why we dismiss them in terms of getting onto them and trying to tease them out. But if we want to progress in this area, I think they're the kinds of things we need to analyse and research.
Really interesting. Very insightful. Thank you, Clinton. I might hand over to Marina now and ask you a few questions. So, Marina, and this even more so in your new role in Wellbeing SA, being very time poor and having a big team and having a huge amount of breadth, how can researchers help you to make informed decisions? And how would you like research packaged up to help inform you as a kind of policymaker?
Thanks, Jackie. Look, I think there's a lot of incredibly valuable research that occurs in South Australia and across Australia. You know, there's a reason why Australia has a great reputation in public health and in research in this area, not just in tobacco control, but in a range of other health areas. And I think that's because we've got researchers who can be incredibly creative and incredibly focused on producing high quality product. The limitation, I suppose, from someone in my type of role is there's so much of it. And so much of it is high value. And sometimes the research, because of the nuance of the question or the hypothesis, is going to be somewhat conflicting because the population group was different, or the sampling was different, or the methodology was different. So I really like the point you made around the policy paper, because absolutely peer-reviewed is the standard that anyone would want in a research context. But being able to pull out the multiple pieces of research into a policy paper to build the credibility of the particular position that's being formed and distilling that into really clear, for want of a better term, and I'm sure there is a better term, sound bites for policymakers is quite important. There's an enormous amount of work that researchers do. There's an enormous amount of work that policymakers do. And having that clarity, having someone assist policymakers with taking the very complex and transferring it into the clear synopsis of what really is the core finding and the core area where we could get some improvement is so important. I also think within that context, it's taking it from multiple angles, like Clinton has said. So what are the health impacts, but what are also the economic impacts, the social impacts? What is the bottom line across a range of domains? Because while it would be wonderful to have the science of health in and of itself win the day, just as you've said in your presentation and Clinton's reiterated, it also has to be at a pace that the community is willing to accept. And I think the line in your presentation around public policy being formed by government on behalf of citizens, and what does the community expect, and what are the community views and beliefs and concerns? How do we frame that so that we don't only have this wonderful science that policymakers can use, we can understand the science within the context of the community in which it's there to serve.
Fantastic. Thank you. And talk to us a bit about like what occurs in the policymaking process beyond science. So, Clinton talked about cabinet, and there's many, or not many, but a number of different kind of constituents that make up cabinet. How can researchers be involved in helping them make decisions?
You're absolutely right. I mean, in a good democracy, there should be a range of different ideas and a range of different perspectives being put forward, and a robust debate on what is going to be the consensus based on all those different opinions and all that different data. And cabinet would be no different to that. So I think in the health portfolio, we obviously focus on our health minister and providing advice to him or her, the minister of the day. But there's obviously a minister who needs to meet with cabinet colleagues who have different portfolios. So how does this decision impact on business? How does this decision impact on social amenity, on the environment? What are the commercial interests or the cultural impacts if it is focusing on particular groups? What's the equity lens? How can a position to improve health and wellbeing in the community also be a position that can be advocated for by other portfolios of interest, whether it be child protection or transport or urban planning or health, not just health, but education. So it's how we are able to contextualize the research and the science, but make it a benefit for the broader community, not just from a community viewpoint of what community expectations are, but what those portfolios may also see in value in that. So Clinton mentioned minimum unit price as an example of an area we could always have more debate and discussion, because there's been so much debate and discussion in the UK and in other parts of the world. But what's the economic impact of that, not just the public health potential positive or negative impacts? What's the community support for the price of alcohol, and what's the impact on export markets and our cultural activity and how the community gathers together? So there's a whole range of other factors that would be explored beyond the health, and that's not to say health isn't a key driver and an important component, but packaging up research to really reflect on who else would have interest in this area, and would they be having an interest because they see it as a potential risk, or would they have an interest because they see it as a potential benefit? And being able to answer and respond to those questions is an important part of being able to frame the policy position more broadly.
That's all really great insight. So really, you might have a Minister for Health who's on side and who understands the evidence and science behind a particular problem. But if they take it to Cabinet and no one else sees the value or sees challenges, so for example with Solaria, the Minister for Small Business was worried about wiping out a whole industry overnight with a policy decision. And so we were able to do some research that actually found out that most beauticians that had Solaria within them, or sunbeds, actually had other products that they sold, and they weren't going to all go out of business as a result of that policy choice. So yeah, important. I think what I'm hearing from both of you is it's not just about the Minister for Health, it's about the other constituents and doing some kind of economic analysis and looking at the impacts on business of particular policy options as well, and thinking about that more broadly. So Marina, you've worked with researchers for many years. What frustrates you most about working with researchers, and what helps you the most?
Well, let me start by saying I'm sure the policymakers frustrate the researchers more than more than the other way around. There's a relationship there which we are dependent upon each other, and also can be frustrated by each other in equal measure. So I shouldn't say it's a. I appreciate that the frustration is certainly can come to policymakers as well. I wouldn't say I'm frustrated by researchers. I'm intrigued by sometimes the questions they formulate and explore, because going back to the earlier point you made, Jackie, has there been a process of, is it an intellectual pursuit of personal interest, or is it a problem that has been consulted on that they think might be adding value to problem solving for the broader community? So how do we separate ourselves from our role and actually think about the collective? That can sometimes be a challenge. But then I also value immensely the passion that researchers have for their particular field of expertise, and wanting to make sure they're being thorough and robust in exploring all elements of that field, which is of value to the community as well. Sometimes I think from the policy, oh, sorry, my lights are going off.
Wave those hands around.
Wave the hands around, there we go. The other component of it, I think, is sometimes both at the policy side and the research side, we can be quite rigid. This is the finding and you can't have any deviation from that, even though there might be some nuance there and some incremental steps that could be made to support each other in moving the agenda forward. And so I think having that flexibility and looking at a lot of policy isn't a big ticket item, it's incremental steps that lead to a particular destination. And having the relationship and networking to trust each other with those incremental steps and test and review. And just as you talked about with the example around tobacco, review the impact of the policy to inform the next step. So I think that flexibility is quite important too. But yeah, I would say it's not so much a frustration as an acceptance that we each have our roles to play.
Fantastic. And we've touched on a little bit in terms of the politics of play. What's the role of coalitions? And, should researchers also inform coalitions about their evidence?
Absolutely. I think there's a few areas here in the policy area which Clinton touched on as well. The science is absolutely important, and the researchers we have in South Australia are, internationally recognised, gold standard research, fabulous resource for us all. But it's also about how we can build a coalition around understanding, well, what are the government's commitments which they've taken to an election or which have come out of a variety of different forums, as Clinton has highlighted, and therefore what's their agenda, and how can we facilitate and support the government with that agenda through the research that we have available and through the research that we're developing, so that we can activate that policy window, as you said in your presentation, Jackie. Being really aware of public sentiment and how do you work with different coalition partners to better understand what's happening in the key stakeholder groups, the key groups that have an interest, population surveys. There's a whole range of different groups who explore work in that area, whether it's from a clinical perspective, a public safety perspective, a wellbeing perspective, an economic perspective. And so really broadening our understanding of the available research and having those coalitions represent that in a cohesive way that still looks at solving the problem and everyone moving in the same direction. And I think that's been really a very strong point of tobacco control policy when we look at groups like the AMA and the Cancer Council, Heart Foundation, Asthma Foundation, university researchers, and that really clear understanding of what the collective problem is and how they want to collaborate and work together as a coalition to move a positive agenda forward for the wellbeing of the state. It would be really good to see more coalitions around modelling. I think we've done some of that in this state, but what if nothing changed? What are we looking at in the future? And I think that can be quite an important piece of evidence to not just talk about what we could do, but what happens if we don't do it.
Mm-hmm.
And those are both equally important to understand timing and whether the current state might be a cost that the community is willing to bear, but the future state is something that they think is far too expensive and far too risky, and we therefore need to act early, like I said, potentially incrementally or in a wholesale change, depending on the appetite for change. And I would say the other thing with coalitions that make them so important is the timeliness. When you've got a coalition, there's multiple partners working in unison who can each take a bit of the work to provide a really timely response rather than it sitting on one party alone. And being ready with the right package of recommendations when the time comes is so important, because sometimes those windows are very narrow, and it's a case of having to get that piece of research or policy approach forward very quickly. And the allies are great for that, because there's so many different people who can bring different attributes, different skills, different resources to that table. And it also gives comfort to people who are the decision makers, whether that be ministers or public officials or NGOs or others, that they have people standing shoulder to shoulder with them to saying, we're backing this. And it's an opportunity to have a consensus rather than a confronting or a debated issue.
Great. I'm seeing a few questions come into the chat, so I'm going to head to that now. So Caitlin Hughes has actually asked two. I'll ask the first one though. Given the key role of public opinion in decision making, can you speak to us a little bit more about how community views are gauged by government?
Well, I can't say there's a range of things. I think you've got community views through population health surveys, and you've got community views as advocated by interest groups who also have a significant say, whether they're interest groups based on an academic university-based institution or an NGO or a business enterprise or a whole range of other groups that have representative bodies in the community. And at the best scenario, it would be a case of when all those things come together and there's that golden thread that ties them together and it creates an environment where we can get consensus. There are many issues in the public health field or in other fields where it's contentious and there is not going to be that golden thread. And so then it's a case of looking at the other arguments for and against, whether they're economic, environmental, social, modelling and what the future looks like without action, to try and navigate that incremental approach. I know there's many things that get debated in the media and through various conferences and groups and journals, and which people would like very quick action on, and that would be wonderful. But how we also need to think about what's the movement of the economy, what's the movement of the workforce, what's the impact on a whole range of domains. So it is complicated. There is no linear solution. But then also, I think with those multiple perspectives creates an opportunity for something stronger as a decision at the end, because we've taken into account all of those diverse impacts and perspectives.
And that is kind of an important role of government, isn't it, to sort of bring in those diverse views often. And I guess at times you would often, do you have industry kind of knocking on your door, trying to explain, or say you brought in a tobacco control piece of or put out an act for consultation? Do you have industry kind of knocking on your door a fair bit around those sorts of things?
Well, we're lucky where we have the framework convention, so we have some parameters around that in the tobacco space. But yes, of course, these are people's livelihoods. It's a change in the way in which they're going to be able to do business and employ people, and employment is also a wonderful protective factor for a determinant of health. So it's getting that balance right and being able to really understand, and hopefully those discussions also help us frame future research questions, because it may be a fear, but it's not grounded in data. And so that can also be a wonderful loop of providing advice back to researchers on, these are the questions that are falling out of this particular approach. How can we answer them? And what else can we do to clarify those positions?
Great. So another question from Caitlin. Given Australia is a federated country, to what extent does the impact decision-making, or does that impact decision-making in South Australia? And under what circumstances are a state government like South Australia more likely to be the first in the country to undertake reform?
Well, I think that might be one for our political leaders to answer in regard to what motivates them. But it's fair to say South Australia's had a history of doing things first outside of the federated model. And I think a good example of that recently is the South Australian Voice to Parliament, which proceeded very quickly in March. And there will be other scenarios that people can draw on from, women's vote back in the very early days prior to federation, a whole range of others. But I would suspect that all governments would like the benefit of learning from each other and supporting each other's resources in developing responses. And so in the health field, there's a lot that the state can do independently, but there's a lot we can learn from other jurisdictions. And certainly areas like tobacco, where there's been, for the term I think we use is leapfrog approach of one jurisdiction testing a particular policy area, which then allows the other jurisdictions to learn and see the impact and then adapt or adopt according to what happens, has been one of the real benefits of being able to grow responses in the area, because each state will have a slightly different perspective on what's the priority, and the other states are learning from that. Federally, of course, there's a whole range of legislation which will sit within the purview of the federal government and what their particular role is and what they will determine. But the COAG frameworks, the national cabinet approach, provide opportunities for that dialogue to occur. And again, it's about the cadence, how much change, how much impetus is there to act at a particular point in time, depending on what else is occurring in the community and in the economy.
And I think that's important for us you touched on a point, it's important for researchers to be aware, are you trying to influence state policy? Is it something within jurisdiction of state government, or is it something within jurisdiction of federal government as well?
And I think with that as well, there's the next level, which is international conventions and what we've signed up to as whether it's World Trade Organization or UNODC. There's a range of international conventions that are also applied in that space. So it's sometimes not even the parameter of Australia, it's how we're actually working in a much broader context internationally on some agreements.
Yeah, thank you. So, yeah, being aware of those international conventions Australia's signed up to, the election commitments state governments signed up to, what they're passionate about as well, sounds important. Michelle has raised a good point. So we've talked a fair amount about modelling and how that would be valuable. Do you think we have sufficient knowledge and experience here in South Australia to do the modelling required for you to make informed choices as policymakers?
Well, I'm not sure, to be perfectly honest. I think there's been some great modelling done. I think it's a growth area. I don't know necessarily that we've been doing a lot of it, or at least I have to put my hand up to say there may be a lot happening, but I'm not seeing a lot of it. So it's about that communication between researchers and policymakers. But I do think it's something that has shown some real interest, particularly during the period of COVID, where we saw a lot of modelling coming out around decisions being made and what those decisions were likely to do in regard to transmission of the virus. So I think there is room and interest to explore that more fully.
Yeah, so you know, as a policymaker, I can imagine it'd be useful for you to see a line. What would happen if we did nothing versus what would happen if we did this particular policy? What would happen if we added this part to the policy and see the impact on health or well-being or whatever outcome variable we're looking at?
Absolutely. And we know they're projections and there's a lot of variables to take into consideration, but often we talk about solving a problem by doing a particular action as though the problem is static. And we know that problems aren't static. They go in various directions, either with improvements or greater risks for a whole range of reasons. So we all talk about the unintended consequences of policy decisions. And sometimes we've seen unintended consequences which have actually been helpful or not so helpful, depending on the context of what's been applied at the time. So modelling, I think, can be a real aid to look at the impact. And even some of the presentation you put together, Jackie, where we look at, well, what's been the trend and the intervention points of policy decisions, and what can we see, therefore, as the overarching trend over time when policy decisions are made. That can also be really beneficial to, I suppose, motivate and encourage decisions which at the time might seem quite significant and have risks associated with them.
Yeah, thank you. We might take one last question and we might all have a bit of a go at this one, but it looks like I might need to respond to this one. So thanks, Rebecca. She liked hearing the examples, especially changing the impact or the impact of changing point of sale displays. Can you comment on how these learnings can be applied to improving the types of foods and drinks displayed at checkout aisles? I'll have a go at answering this one, but Marina and Clinton chip in as well if there's things that I've missed. But I think, you know, from my perspective as a researcher, it's usually about, you know, having a hunch about, you know, what those sorts of, you know, displays might do for consumer behaviour. And then thinking, okay, do we need to do research to find out exactly how those displays influence consumer behaviour? And then think about the target audience, you know, is it kids it's impacting or adults, or trying to test the impact across a number of different groups? Because obviously, you know, there's parents. Is it causing kids to pester parents? Are parents more likely to buy them? It's important to kind of try and unpack all of those sort of hunches that you might have and see whether, in fact, it is true by doing some surveys and research. And then it's probably about talking to policymakers about, you know, how would you go about those displays? Is that something that government can even legislate for, or is that something that you need to talk to individual supermarkets about? So finding out, is there a policy solution for those things? And then finding out, you know, at that point, I'd probably be wanting to talk to the key policymakers in that space. Is that something they think is a priority? Because sometimes it's being mindful of their time and do they see this as an important piece of the puzzle, or do they see something else as a more important piece of the puzzle that they're trying to see change in or learn from? But collecting information and data, and not always at one data point, building, working out, I think, as Marina said, how your piece of research fits in the broader body of evidence, because you're not going to be able to answer all the questions with your one piece of research, but putting together a policy briefing, drawing together everyone's opinions is probably a good way to go. And now we're on time. So Marina and Clinton, do you have any other thoughts about that?
I totally agree. Oh, you go ahead, Clinton.
Look, I'll just quickly look. I think that's largely about how point of sale displays for tobacco was framed. I think we were successfully able to shift the framing from this is purely a commercial exercise in displaying our products for the purpose of the consumer being able to purchase them and making a choice. And we reoriented that and reframed it to a form of advertisement. And by doing so, we moved it into a sphere that was related to tobacco advertising, and that shifted the whole way of thinking about it. So often it's not just about evidence, but evidence to kind of explore what question and what framing of an issue that is really important.
Right, thank you, Marina.
The only thing I'd add to that is I agree with everything that's been said, but also to remember the amount of political capital that anyone can spend at any point in time. And we get some fabulous ideas from many, many different parts of the community, and it's which lever do you want to pull at which point in time for the best return on investment for public health and safety. And that isn't to say the other ideas aren't brilliant, but it's how much can you do and where would you want to put your effort to actually make sure that there's a concerted approach in that one area.
Yeah, thanks, Marina. That's probably a good point around looking at what are the best buys. You know, sometimes WHO release best buys documents, or the blue chip document for tobacco control about what's the best way to see change in behaviour. Thank you very much to both of you. I'll quickly hand back to Sarah now.
Thank you all. Having the wealth of knowledge from you, those who are actually influencing and shaping policy, and then Jackie, your practical, how you have shaped policy as well has been fantastic. So thank you all very much. I just want to quickly let everyone know next week, same time, we've got an Influencing Policy 101. So it's going to cover lots of things, the basics. What is policy? Who's a bureaucrat? Who writes policies? And Carmel Williams and Associate Professor Kristen Carson-Chahal are going to be presenting this. They have a lot of experience. And that wraps up for today. So thank you, everyone. And I'm going to finish now.